Hi, this is Dr. Robert Parker, my good friend. We go back many, many years. We're not going to count them here, but we're going to give you a little snapshot of our journey to find out the question of vascular and neurovascular problems of the human leg. In 2011, we went to Mayo Clinic to learn microsurgery. And this is a close-up of a rat's sciatic nerve and blood vessels in the gluteus area. We were somewhat younger then, but still viable today. So Bob, it's really a pleasure to have you here. Remember that was 2011.
I know, it seems like it was just yesterday,
It
literally.
does,
People
doesn't
say
it?
that all the time, but it does.
It does, and the hourglass keeps moving it, sand through the hourglass. But we learned a lot of things, and this was one of them. And we took Dellon's training, which is the training we had at Johns Hopkins with Lee Dellon, taught us nerve decompression. We used loops. That's 3.5 magnification. Here it was 20 magnification.
Exactly.
So a different world.
Exactly.
And that world is different when you look through loops or magnification. And when you learn a lot of things that you thought you knew, but you didn't because you have a different viewpoint. Now we're into the world of stem cells. And when you combine Dr. Dellon's theory, magnification, and stem cells, and we're going to define what stem cells are and how they're used, but you have a unique story, a very unique story about Lacey.
I do. Lacey was my wife's dog, a white German Shepherd, and she loved that dog. She also had another dog at the same time, Allie, and Allie was had cancer. So Pam was going through her mother falling, fracturing her hip, taking care of her mother. She had literally with her every day, 24/7. Then she had this Allie with cancer, and now here Lacey, all of a sudden within about a month, had become a paraplegic. And so we are literally putting a cinch under her rear end because she's just dragging these two limbs, walking her out to go to the bathroom. It's winter time, it's wet, and of course she wants to walk right through the water. And we did this, a couple of times a day.
And how old was Lacey?
Lacey was right at 14.
14, so she was pretty advanced.
Pretty advanced.
And then you thought, well, let's take her to the veterinarian. What did that veterinarian say to you?
So the vet came in. Actually, this was the associate vet, so not the main vet that I'll tell the rest of the story with. But the associate vet comes in and he gets all emotional because this is exactly like the dog he had that had this myelitis, spinal myelitis, and his dog did the same thing. And so he nurtured that dog to its end and was very emotional about the fact that Lacey was there with the same condition. And so he literally came in and sat on the floor in front of us, like he camped in to tell us the story. So when he did that, he went through all the experience he had with his dog and, a disadvantage of letting a dog just die slowly like that. And the end thing was, the comment to Pam was, it would not be unkind to put her down.
It would not be unkind
To put her down.
Put the dog down, meaning down, meaning
Terminate.
Terminate.
Yeah. So Pam was just all emotional and it was horrible. And so I'm looking at the door and here's this stem cell sign and I'm going, whoa, okay, where's this conversation? So he said, I'm going to leave everything, let y'all talk. And so he left. And then this young lab tech, basically, the assistant tech for the veterinary group there, was into stem cells. And he came in.
When you say he was into
stem cells. Well, so he came in and I must have had scrubs on and he said to me, what do I do? And I talked about nerve surgery and so forth. And you and I had been to Panama, we'd been to Boston, been to Utah, we've been to Miami, all of these, Dallas, all these big names in stem cells. which he was fascinated with. And in fact, I didn't know it at that moment. But then he started describing that he had a stem cell lab right there in the facility.
So they harvested stem cells?
And then plated them and cultured them.
Cultured and grew the stem cells.
Grew the stem cells. And so he said, would you like to see my lab?
Well, of course.
And so we're going, well, absolutely. So Pam was just sort of there with Lacey. And so I left and we went around to his lab. Well, you and I had been to Dr. Reardon, who has the stem cell lab down in Panama. And we saw the labs of.
So was it similar?
And his lab, his brand new lab in Dallas, you remember?
Right.
And it was exactly the same setup.
So the same setup. So they're growing stem cells
Yes.
in the laboratory, sourced from dog canine source.
Yes.
Okay, but the process is the same.
The machines pretty much the same, except of course Reardon had some pretty big $100,000 scope and everything.
Oh, absolutely.
And so he didn't have that, but he was doing the same thing, making stem cells.
So you saw the laboratory. Did you suggest to him for the use of stem cells for your dog?
Well, Pam, I didn't want to leave Pam too long, so I told him, I said, when we had the conversation, he realized, my gosh, this guy knows what I know, about stem cells, and so he was all excited, and he said, I want you to meet the main veterinarian because he's the one that started all the stem cells, and it turns out this young man is his son, So,
oh, I see.
Yeah. So then I said, well, look, give me your, he said, I'll give you my telephone number. And I said, well, I want to talk to you a little bit later, So we left, and so I called him back later when he said it'd be a good time to call. And I said, why didn't you suggest stem cells? I see stem cells on the door. And he said, well, we can't ethically recommend that. We don't have enough science behind it yet.
So there's no studies that for this particular problem.
Yes.
But he obviously believes in stem cells or wouldn't have them. But this particular application he hadn't done.
Correct.
Okay.
Yeah. Well, if they did, they didn't have enough numbers. So I said, well, look, I just want you to know this. I would like to do the stem cells. He said, well, I'll ask the main doctor if it's okay, and we'll see what he says. And I thought, well, when you talk to the main doctor, tell him we're not just treating this dog, we're treating my wife.
Right.
So he said, I'll do that. So it was so great. The conversation was really good. He called me back and he said, the doctor said, if you'll pay for it was pretty expensive, then we'll do it. I said, so be it, let's do it.
But you had other thoughts because you're training with Dr. Dellon. If this is a nerve issue, did you elicit a Tinel or provocative sign off of Lacey on her common fibular nerve?
So this is an interesting story. So we're a little early on that yet. So then we got the stem cell treatment where you actually intrathecally inside the spinal cord area, he put the stem cells and did a beautiful job. Within a month, this dog was up and walking, and we've got pictures of that video.
So you have pictures of the dog. Did you have like wheels in the back?
We did. We bought the wheelchair, which was a nightmare.
So the dog is basically in a wheelchair.
Paraplegic, yeah.
And now the dog is?
Yeah. Now the dog is up walking around, but clipping is like you and I have done forever. We learned through Dr. Dellon, reversing drop foot by releasing the compression of the common fibular nerve.
So that's the nerve right here on humans right here.
Yes.
It's a little different anatomy because they're more not plantigrade, they're equinus type of foot.
Interestingly enough, the anatomy was pretty darn close.
Pretty close.
And so what happened is that I could not tell because you can't say, well, Lacey, does this hurt when I press over this? And you and I both know that nerve is a mixed nerve. So it's a sensory nerve, but it's also the major motor nerve for lifting your foot up, right?
Correct.
So because of that, I called him back 3 months out and said, listen, this dog has what I think is drop foot. And so I got, at that moment, or that time, I had developed a good relationship with the main veterinarian there. It was his clinic. And so I presented to him what I thought was happening. I said, I cannot tell if this dog is having pain. He said, well, I can. And he was very intrigued with this. because he loves stem cells, and the fact that Lacey was doing so well.
Why did he love stem cells?
Well, he, like you and me, he was a student of stem cells, so much so that he brought that technology. And I told him that we can't do this here in this country, and
certain forms of stem cells, and we can't. Yeah,
right, where we plate it and increase and give it intravenously and all that. And he said, well, we're under the radar. We're treating animals. The FDA just doesn't bother us with this, And so that was, I thought, first of all, okay, this is an interesting conversation. So I suggested to him that, and showed him 3 videos of some of my patients where we completely reversed drop foot, got rid of the pain and burning and tingling down the front outside of the leg. And he said to me, I'm going to bring in cadaveric studies, pro-sections of this exact kind of dog from Texas A&M, and we'll go over these. If you'll come to my office, we spent almost 2 hours looking at the anatomy, and it was just pristine pro-sections, and we determined that it was pretty much like human. He said, here's what we can do. I've got a cadaver. We'll do the cadaver surgery. You can teach me the procedure, and I'll operate then on your dog, your wife's dog. I said, perfect. So, and before that, by the way, he said, I can tell if this dog is having pain. And he put Lacey up on a table where we were standing, and Lacey's just right here. And so he said, animals, if they show pain, like a human would wince or something, he said, if animals show pain in the wilderness, he said, they're dead. It's a weakness. And so you have to have that skill, and this is where the vets are amazing.
Let's talk about that skill for a second, because I think a lot of people who are very stoic don't want to show the pain side of their personality, because then they're prey.
Exactly.
So they guard themselves and keep that within themselves, because I've seen that with patients we've done. And I would say they would just break out in tears after we fixed their pain. But I said, I really didn't realize you had that much pain. And how do you know how much pain you have, especially if there's no answer for the pain? You have to be stoic, because doctors like us say, live with it or die with it.
Yeah.
But when somebody relieves the pain, the emotional rush is beyond belief.
It is.
And we've witnessed it. And I've witnessed it myself as well.
Yeah.
So continue with your story. So now you have a special skill set. You know stem cells and all its iterations. You're micro-trained at Mayo Clinic. You're trained by Dr. Dellon, the world's leading authority on this subject. You've done thousands of cases, and here you're presenting it to a veterinarian on your wife's dog. Yeah. You're probably the only person in the world who has done this. Let me just take that other word, probably, out of the context. You are the only person, and you are the first person who has ever done this procedure on a dog. I think so. It worked.
Yeah.
That's impressive.
So what happened when he showed me by demonstrating, I showed him where I could palpate the common fibular nerve as we do, rolling it under our finger. And I pointed out, I could feel it on Lacey's leg. And so he said, well, I'll be able to tell if she's hurting. And he said, she's hurting. And so we said, well, let's do it. So we did the procedure. I did the procedure on the cadaver. And he's on the other side. It's really strange because we wore no mask. It's a different environment. So when I'm, and by the way, his nurse was taking pictures, which he made into a series of pictures, almost like a movie, that shows this beautifully. It shows going down through the tissues, shows the fibrous tissues you and I divide every day, and down to the common fibular nerve. And there it was, so it was dented just exactly like humans. So then we're sitting there, and he said, I said, well, okay, doctor, you can take over now and take care of Lacey, Pam's dog, Lacey. And he said, no, he said, that is just too what did he say? He said, that's too detailed. He said, I've never done nerve surgery in a peripheral nerve. He said, you have to do the surgery on your wife's dog.
Well,
I'm going,
but you've done thousands, but you had the additional
pressure.
Yeah, but you're used to pressure.
Yeah.
So your training
yeah.
allowed you to get to that point in life.
Yeah.
And you're one of the few people that had the skill set and the opportunity, and you seized on the opportunity. And tell us what happened to Lacey
So
after that.
I decompressed common fibular nerve. We could obviously see it was compressed. Right after I did that decompression, he then put stem cells in and around the common fibular nerve, and then he closed it up. And then we went immediately to the intrathecal injections for the spine, which was very difficult. It was so bad that he had much difficulty getting into the area.
Because there was lipping on the spine,
Closed
so that
down.
the space was too small.
Exactly.
But he did get it in, and he used the same cells on the spine intrathecally as
Exactly.
you did with the localized surgery on the nerve. No different.
Except that his were plated and multiplied into the millions.
Okay, but so the ones on the common fib were not plated, or what?
They were all the same.
all the same cells.
Yeah.
Okay.
Yeah, yeah.
So how long did the dog take to recover?
So miraculous, it was just amazing. So the dog, within 3 months, the clipping had almost completely
Clipping
gone away.
that
So clipping
foot
is
drop.
dragging the claws, right? And like humans, we'll catch a toe, or we call it slap foot or
Yeah,
steppage gait. And so Lacey, you hear clip, clip, clip as she's walking on that paw. And so it's just amazing. So we've got films of her walking without the clipping, and she lived a year and a half after that.
Wow.
Yeah, it was cool.
Huh.
Very cool. So it's like a year and a half that she
So-
lived beyond that.
Now we have.
I get
had-
emotional talking about it.
Well, you should, because of the seminal moment.
Yeah. Yeah. Good.
So it wouldn't be so unkind to put your dog down
Yeah. Which we hear.
all the time with humans.
Yeah.
It wouldn't be so unkind to let the course of the disease take its step.
Yeah. Keep you on medicine until your nerves die.
And it wouldn't be so unkind to amputate the leg.
Right.
But if you have this specialized knowledge, which you do, with stem cells and decompression, which 99.9% of the doctors in the world don't, and they would criticize us for trying to push the envelope. Now, we're just not out randomly doing things. We went every place that we could possibly go, from Mayo Clinic to Johns Hopkins, Stanford, our friend at Harvard, Michael Hamlin, with the laser and the red light therapy and LED and the biochemistry. We're trying to put together a protocol that can legally do all of this stuff in the United States for all these different problems.
Yeah, it's a symphony. It's a constellation of treatments. It's not just one thing. And then your book, Sugar Crush, I give to every patient that comes in my office with nerve conditions, because you and I would sit and try to have the conversation about what's in your book. How do you do that? How do you even talk about one chapter?
It's complex. To me, it's just a lot of little dots that have to be put together. But I, like you, same path. It's not like we did this in a week. This is 50 years worth of work.
Yeah.
Now, in the new book, which the public wants to hear, how to get unglued. They know that sugar is bad. And I'm critical of people eating the sugar, and I can imagine you come in, you see me, and say, why'd you eat sugar? Well, that's really not the question. Sugar caused this itis, and I'm here to fix it. I do want you to be off that diet. Now let's talk about back to Lacey. What kind of diet did she have?
Well, it's the out of the bag.
Out of the bag.
Yeah, I mean,
What's
she
in
had
the bag?
a lot of dogs. In fact, we bought some carnivore diets for those dogs, but they were so just like the pre-diabetic or the diabetic in our practices. And you just stop immediately. They
It's
go
hard
into
to do.
withdrawal. You get that withdrawal you talked about. So both our dogs got just sick as they could, taking and eating meat, raw meat, which
So-
I think could have gotten them well if we'd had a good program.
Back to rats. I started out with rats. They weren't my in-laws. No, these were real rats. No, I'm kidding you. These
You
are rats
dirty
that I
rat.
worked with at the Ben Franklin Clinic in Philadelphia in 1967 with the world-famous geneticist and biochemist, Dr. Michael Sheff. And we fed the rats, like you're saying, with a chow, as they call it, which was all carbohydrates versus more carnivore, because rats are carnivores. And when you feed them grain, they get sick. And when you feed grains to dogs, because they're carnivores, they get sick. And when you feed carbohydrates to humans, guess what? They get sick. But we can fix these rats, we can fix these dogs, but we can't fix humans because of a lot of regulations that are placed in front of us. So people are going to different clinics around the world to get this. They're going to China, Panama, Mexico, because we need, quote unquote, more research. Well, we do need more research. We're spending trillions of dollars in research. We spent $1 trillion on one drug, on statin drugs, for a disease that's caused by sugar. There's $1 trillion would have solved the whole problem.
And the statin drugs have been proven not to stop one heart attack.
Correct. But that's continuing. That's FDA approved.
Yeah.
This isn't, and some of it is, but some of it isn't. And we're not against research. But we need to shift the focus to what is needed. The amount of people who are losing their legs in the United States is staggering. In my way of thinking, all these neurodegenerative diseases, from Alzheimer's to autism, are all the same. They're just different nerves, just like Lazy's nerve was on the animal, other than human. But it doesn't matter, because stem cells, as I say, don't give a rat's ass what you call uritis. And I've been in rats' asses, and here's a picture of one. And the reason I say that is because this is one of the reasons for that, but there was another paper that was written in China. They took a rat, same rat, same species, sectioned this nerve, which you can't really see here, it's so small, and put a neural tube in and rendered these rats weakly, which means they euthanized them. And then they wanted to see if the axons, which are the smallest particles of nerve, would grow across the gap. And they did. And that's why I say stem cells don't give a rat's ass what you call uritis, because it doesn't matter which nerve. It doesn't matter what human beings call it. These are names that are assigned for an effect, not cause. And that's a whole other discussion. We don't have to have that here. But I can't thank you enough for telling this audience what you did.
It was interesting, and it was very gratifying. But you and I both had the experience of what I think maybe 18 years when we did this for Lacey. You and I went back to day one with Ellen, as you mentioned. And unless you see that the difference in the nerve itself, the physical difference in how that nerve looks, and then also see the results once you're trying to close that operation, the nerves plumping back up and looking better, and then the patient comes in, their foot's moving, they have better balance, they have better sensation.
But didn't we, when we started to learn Dellen's technique, criticize this is so dangerous by the medical professionals, the ones who prescribe Lyrica and all those medications?
Interesting you said that, because I'll tell you a quick story. It was really a seminal event for me, because I had just come back from the training. I had my first surgery. I asked an orthopedic surgeon at the hospital, because I'm a foot and ankle guy, and what are you doing up here at the top near the knee? And so I asked him to come in with me to my first surgery, which you sat in, and so we're in there. He said, "Sure, of course, I'll be glad to." So he came in, and I'm dissecting down and showing him each of the portions of the procedure. And here we get to the common fibular nerve, and he said, "Bob," he said, "I haven't seen that." He's a knee surgeon. So he said, "I haven't seen this nerve since medical school." And he said, "I don't want to see it." Right?
Sure.
So then there you've got this, how many surgeons actually even look at nerves, see nerves, you want to avoid them always. First thing you mention when you make the incision, you're going to go through the skin. You're going to go into the subcutaneous tissues. You're going to retract the neurovascular bundle to protect it. So nobody wants to see the nerves. You and I go looking for it.
We do.
So, so then the patients come back, their balance is better, their life has changed. Just like anything, you can have cardiovascular surgeon, you can have a heart transplant, but if that patient goes back out and gets a fast food hamburger, and that's his meal, he's just blowing in the wind because it's not going to do much good for them. And we have to educate them, which is what your book has done. And I don't have to sit there, Mrs. Jones, and go through each chapter with the patient. Here, read Dr. Jacoby's book. It's going to tell you how you got here. And it's been so valuable for my patients.
Well, I appreciate that. So in the new book, Unglued, yes, this is how you got here. And the new book was going to say, what is the solution? How to get from this pathology back to health. Bob,
Enjoyed it.